Lung cancer has changed dramatically over the past decade. We've had now immunotherapy, which patients might see commercials for on TV about how that's changing the way lung cancer is treated, and ask your doctor about immunotherapy. And I think now the surgeons, the radiation oncologists, the oncologists, we all know about it, and we all work together to give that kind of medicine to patients that need it. The survival with these sort of adjuncts is just getting better and better. And the ability to do surgery is also getting better. So we might be able to offer curative surgery to patients that we never were able to offer it before, just because the other medicines are getting so much better. So I think that is super exciting. When patients come to me with, usually it's early stage lung cancer is what I manage the most with surgery. When patients come to me with that, I do sit down and kind of write down these are the options that we have, and I give them my opinion on what I think is best for them and the reasoning why. And I talk to them about surgery, the outcomes of that. But sometimes patients are kind of in between. They might be a good candidate for surgery, but a good candidate for radiation as well. And the data is not really there to support it. And that's when I give the outline of these are the benefits of this, these are the benefits of the other one, these are the downsides of surgery, these are the downsides of radiation. Every patient's different. Some patients will say, I really want surgery, I want to get this thing out, and I'm there for them for that. And if they say, I really don't want surgery and it doesn't seem right for me, then I'm there for them too, because that's what we're here for ultimately, is helping them make an informed decision about what's best for them. So I've always wanted to be a doctor, and I think part of that was because my grandpa was a general surgeon. He grew up next door to me, so I always had that inspiration and knowledge since I was a young child. And then growing up, the more and more I thought about it, I really did fall in love with surgery. But then in medical school and residency, I fell in love with treating patients with cancer. Part of that is because I think there's so much going on in the cancer field right now. And in addition, I've been touched by cancer in my life. Like with my mom had colon cancer, and then 3 of my family members have died of lung cancer. And just knowing that there's so much more we can do to help patients with lung cancer, and how it's the biggest cancer cause of death in the United States. I just think there's so much more work we can do, so I wanted to take a part of that. When you've had personal experience of family members or personal history of cancer, then yeah, I think it does make a little bit of a difference, because you can see yourself in the patient or the family member's shoes. And I think that personal connection is super important. I also think that the pressure they feel outside of just the normal medicine you're giving or surgeries you're giving in terms of the psychological effects of cancer are super important, and things that we need to take into consideration when we're treating patients. It's not just about the body, but also the mind and the family and everybody. So it's a big thing for patients. One thing that I remember as a really rewarding case was a patient who came to me and was super nervous. She had a cancer spot in the middle of her chest and was really nervous about going through surgery, was scared she was going to have a lot of pain. And we had a long conversation about it, because she wasn't really entirely ready to get surgery, didn't know if it was right. But after discussing with the oncologist, the 3 of us, me, her, and the oncologist, all decided it was the right thing to do. And we did the operation, got good margins. There was no cancer remaining after the surgery, so we got the whole thing out. And to this day, she remains disease-free. I remember after the operation, her coming up to me and being like, this was so much better than I thought it could be. Thank you so much for everything. And that was super rewarding, because I was with her that whole time and I knew how nervous she was. And so I'm happy she didn't have any problems and she got through it really well. Screening for lung cancer is super important. And I think one thing that a lot of people in the community don't know is that breast cancer screening is super important, and it gets utilized about 50% of the time. But lung cancer screening nationally has about a 10% uptake rate in the patients who are appropriate for screening. We also know that lung cancer screening is the most effective screening, and that it can save 1 in 100 lives every CT scan that's done. Anyone who is a smoker from the age 50 to 80 is most likely eligible for lung cancer screening. In addition, if you have high-risk factors, like you've had family members with lung cancer, things like that, those can be other indications that you need a lung cancer screening CT. So I think that is a super important part of our job, is getting that information out there to the public to know that they can be their own advocate in this sense. I think us as surgeons, we deal with patients when they're maybe in their lowest and most vulnerable state, because they're getting an operation, so they really have to trust you. Being a surgeon and having a patient there's a special connection, right? And bringing them in and telling them, you're cured from your cancer is one of the best feelings we can give a patient and ourselves, that we cured them and their cancer's out. And then when someone might go through a long recovery for whatever reason or another, or come in with a bad problem and they come through the other end, it is an extremely rewarding feeling to see a patient finally getting back to themselves and smiling again. I think that is one of the reasons why a lot of us want to do this job, is because we can help patients and get them back to their lives and be with their families, etc.